Upwards of 30 million people are blind in Europe. But what really flabbergasted me was to hear that 50% of that is preventable.
The economic costs are tremendous. They can be mentioned, for each country it's different, but they can be mentioned billions and billions of euros per country.
Blindness is a huge invisible threat. Lots of these conditions, for example glaucoma, don't have any symptoms in the initial stages. So a patient may not realise that they have a significant problem with their sight until they have quite advanced stage of sight loss. So the important thing to do is for Europe to do all that it can to work with us to raise awareness of these issues at the European level, in particular about the importance of regular eye checks.
There is a huge economic burden, not just a human burden, but an economic burden, which runs into billions of euros. This is the kind of money that we could use for building hospitals, for building schools, for building more roads and so on. All this money and the human suffering which goes with it could all be saved if only we stop blindness before it actually happens.
The socioeconomic impact centres on the costs on healthcare systems, but also on the costs on the social care systems for the adaptations necessary to support individuals with sight loss. If we don't act on this issue, the numbers of individuals at risk of sight loss is going to increase dramatically with the ageing population, and with that the associated healthcare costs and social cost systems.
Blindness and eye diseases may have been overlooked. What we'd like to underline is that the costs are tremendous, much more than what we had anticipated. So what we're suggesting is it's up to the policymakers to prioritize this issue. Our estimation is that by deploying such cost-effective treatments and prevention methods, we will be able to not only avert the healthcare costs, but the burden on the society that manifests itself as productivity losses and indirect costs.
It would make sense at a European level if we could have an accepted standard that would be used across the EU, because then we could compare data and we would have good, robust data, comparable data across the EU. And when you have that, then it's much easier to convince policymakers of the need to do something about it.
Europe doesn't have a specific competence in the healthcare field. However, it does have competence over employment law. It has competence over transport law. So, for example, when they're recasting the driving licence directive, that Europe should give consideration to the importance of including regular assessments of drivers' vision throughout their career, and that will also assist to pick up these conditions at an earlier stage.
Well, we have this public health function at the European level. It is our duty to help educate and inform citizens across all of our different countries, this event last year we showed some of the deep misunderstandings and misapprehensions people have about blindness and its causes, and this year what we're saying is that governments in Europe cannot afford to ignore that, because the cost of caring for blind people is so much more than the cost of informing people. Prevention is better than cure.
If you know that there are upwards of 30 million people suffering from a disease, and that half of that, 15 million of them, don't have to, that you could prevent it, that's surely a call to action.